My name is Madison. This is my Saline lock IV insertion checkoff. I'm a student with the University of South Alabama. Okay, so first things first, we would walk into our patient's room, introduce ourselves, and verify our patient using two identifiers. So Jaguar Jones, 82563, 82563, and then we'd also assess for his allergies, penicillin. We would double check our orders and explain the procedure to the patient at this time also. Then we would perform our hand hygiene, position the patient at working height, lower the bed rails, and make the patient comfortable and position them for the procedure. In this procedure, they can either be sitting up or be laying supine. We would also don our goggles at this time. And for assessing or picking out your vein, you would want it to be in the distal portion of the arm that you select. You would want to select the non-dominant arm, and you also want the vein to be bouncy. And then for the fostering venous distension, you can have the patient create a fist, slow fist, apply a warm compress to it for vasodilation, or you could stroke the vein as well. So then we would open up our kits. And we would also organize our supplies. I have already pulled my tape and placed it on the edge of the table. So now we can get our alcohol pad and we'd open that, disposing of it, and then we would carefully pull out, and we would cleanse tip, dispose of that, we'd take the cap off, and we would connect that. And then at this time we would also prime it. And gently, carefully lay it back in there. Okay, and then we would get our waterproof pad, and we would lay it underneath our patient, and then we would get our tourniquet, and you would place the tourniquet 4 to 6 inches above the insertion site. Okay, after that you'd perform your hand hygiene once more, and then you would don your clean gloves. Okay, and then we would get our chlorhexidine, crack him, and then we would cleanse. And you would also go into circular motion. Okay, and then after that, you would do that for 30 seconds. Then you would dispose of him as well, and you would also check their, you would have checked their radial pulse and appropriateness when you put on the tourniquet. Then we would get our catheter, remove cat, and you would do this bevel up, spread the skin without touching the part that you just cleaned, You would insert, bubble up at 10 to 30 degrees, wait for blood return, lower the needle, and then you would advance the stylet without advancing the needle. And then you would pop your tourniquet, apply gentle pressure, stabilizing that, and you would also pull out your needle. Then you would grab your lock. Being sterile as well, and then you would lock it on there. Okay, and then you would also make sure that's open. And then you would aspirate for blood return, and then you would push the remainder of the saline and then you would tape this down, and you can let go and disconnect, disposing of that syringe. And at this time you would get your tegaderm out, and then you would remove the backing, disposing of the backing, placing the tegaderm up, but you would not want to cover up that lock where it connects. And so then you would remove that. And then you would also tape, you would this time, you can remove the other tape, but you want to make sure that you stabilize. You could dispose of that. And then you can tape it down in the direction that it's wanting to go. And then you would also label your label with your initials, the date, the time, the gauge of the needle that you used, and you would place it on the outside portion of your bandage. And at this time, you could remove your gloves, disposing of them, and you would clean up your station, perform hand hygiene, reposition the patient in a comfortable position, raising the bed rails, lowering the bed. You would teach the patient about the saline lock, tell them about look for signs of dislodging or any symptoms of infiltration to let us know if the fluid was getting low or it had stopped, and to let us know before showers so we could wrap it for them. And we would also document what attempt number this was, the size, length gauge of the needle, the location, what fluids were running, what was the drip rate, how the patient handled the procedure as well. And then I'm going to do a second video for my removal because I did not set my stuff up for that.